So, Inder, I just wondered, could you describe one of the changes that you made that had a positive change?
The most important change for me was talking to the staff and taking their experience on board. And on most of my discussions started like that. And then I think I have to start thinking about the principles of quality improvement. Based on those discussions and principles, we need to standardize our practice. And that standardization, doing it in a very systematic way, if I'm doing this for this particular group, it should be same for the next group. Because our patients, whether in the hospital or community, can be having a very similar set of problems. So standardization, systematic review of an assessment for those older people helps.